And okay. David, if we start the poll, does it show up on the screens? I wonder of those people that are coming in.
Yeah.
So let's do that. So good morning, everyone. I'm going to start the call. We have quite a few people coming in. They'll be joining us. And I do have a few minutes of opening. And what I'd like to do right now is I would like to start with a quick poll. So as people come on, we'll just take those minutes. David, if you could put the first poll up.
Sure.
And then as soon as we've got most of the people on within just a minute or so, then we'll move forward with the agenda.
Yeah, just give me 1 second.
Okay, that sounds great. Welcome, Care Bangladesh. We're happy to have you on the call. Yes, Kathleen K. Thomas, the presenters are amazing. We're looking forward to this very much today. All right, so please, we've got a poll up and we'd like you to submit your response to the first poll, if you will. And David, do we still have people coming on?
Yeah.
Okay, great. Then as we poll, we'll welcome everyone. Yes, today it's lovely to see my very dear, trusted colleagues and friends from around the world. This is really a special day. Yeah, absolutely. And we will start the introduction at the 7:05. Oh, there it goes. So David, how are we doing there?
Great. We have already 42 people voting. And I'm going to show the results now. I think that it's time for us to start.
Let's do that. Let's show the results because it's time to start. So we wanted to know how many times you've been joining us, and 58%. So it's the first time. So welcome to all the newcomers. And for those of you who have been with us a few other times, we're so happy to have you back. So let me now start officially start the call with, again, a very warm welcome. Thank you for participating in the poll. What I'd like to do is just make a few comments and then we'll move into the agenda. This is an important call because as the COVID-19 pandemic continues to circle the globe, organizations working in conflict areas are faced with mounting pressures. Of deepest concern to so many of us is the access to diminishing resources for women, children, and the most vulnerable populations in these areas. Conflict areas, as you know, are home to those who are especially vulnerable to COVID-19. These areas often include large, overcrowded populations without the ability to safely distance themselves, in areas without access to sufficient quantities of water, making hand washing impossible. Our speakers today will outline how they are coping with the additional challenges that arrived alongside COVID-19 in their communities. Yet there are also hopeful signs in conflict zones where tensions between adversaries in some areas are waning. These sparks of hope are illuminated in the ceasefires that have been enacted since the beginning of the pandemic, including the Saudi-declared unilateral ceasefire in Yemen, which was recently extended for another month, and a lull in fighting in Myanmar. This exception, of course, being there is the exception of Rakhine State. This call is the first in a series on conflict and COVID. Later this summer, we will address the longer-term effects of the pandemic in conflict areas, including how we can integrate our responses within the framework of the humanitarian to development nexus. Today, our agenda will include an accomplished panel of presenters with extensive experience working in conflict zones around the world, bringing you face to face with the realities of how COVID-19 is affecting their work on the ground. Before we begin, however, I would like to offer a note of thanks to two special people. Michael Shipler, the Vice President of Search for Common Ground, and core group member Giorgio Trombatori, Relief International's Director of the Whole of Syria program. Both of you have served as trusted thought leaders in the weeks leading up to this webinar. And for our call, and as our call gets underway, I would really like to thank you each for your incredible support and your wise inputs. So now you see on the screen the flow of the call. We will begin today with the featured speaker. Akaleki Christian Leki will talk to us presenting youth-led efforts of blending peace, building strategies, and youth-led peace architectures, and I love that word, to provide resilience and mitigate the spread of COVID-19 in conflict areas of Cameroon, which he will talk to you in detail about. We will then pause for discussion, and I have another polling question for you. And then we will move into a list of panelists from Search for Common Ground, Relief International, FHI 360, another pause. And then for the COVID Resource Center today, we have a very short video at the end. It's a 3-minute video, a very exciting opportunity and something that we're doing that is very new. And we'll be sharing that with you at the end of the call. And David, could you just go to the next slide, please, so I could, before I introduce Ekaleki, I'd like to just share who the panel of presenters are and what we will be discussing today. We will be welcoming Judy Kiamo, and excuse me, that's a typo. There should be Kiamo with an A, not an O. The Swahili Coast Director of Core Group Global Partners Search for Common Ground. And Judy is going to discuss how she is facilitating collaboration with a multitude of partners across dividing lines to manifest conflict-sensitive responses from the Swahili coast up into Somalia. Judy will be followed by Dr. Kassim Baloud, the Whole of Syria health specialist, who is joined with Alia M., the HR manager of core group member Relief International. Dr. Kassim will contextualize the challenges in mounting a Whole of Syria emergency response during COVID-19, and the team will include a special focus on duty of care and wellness approaches for staff and community partners. And then we will have Mike O'Brien with us, the health advisor for the crisis team of core group member FHI 360, who will outline proactive responses to the complications that COVID-19 is having on FHI 360's Ebola operations in DRC and in their health response in Yemen. Next slide. All right, so before we start with our featured speaker, I have a question that I'd like you to consider in the chat box, please. We're really interested to know how you are adapting your work to respond to COVID-19, and especially in those areas where conflict is doubling efforts, tripling efforts, and putting so much more pressure on you. So the question that I have for you to stimulate, kind of some discussion in the chat box, and we've asked our presenters to be very active with you throughout the presentations as appropriate. What have you needed to adapt in your work to respond to COVID-19? Please let us know what you're doing differently because of COVID-19. And now, if I could just ask David to, yes, all right. So what I'd like to do now is I'd like to introduce to you our featured speaker. And I'm really happy to welcome Akaleki Christian Leki, who was born into a community renowned for the involvement of its youth in violent extremist activities. At an early age, he was a victim of radicalization. He then succeeded in transforming himself from an agent of violence to an ambassador of change. Today, he works for peace, opposing violent extremism in Cameroon and around the world. Akaleki Christian Leki is a man of creativity, connection, and collaboration. In his 13 years of service to young people and communities, he has reached out to, empowered, and inspired over 1 million young people in Cameroon and abroad. Over the past 5 years, Akaleki's work has received many awards, and his achievements are noted throughout Africa and around the world. Among them, in 2016, he was named Commonwealth's Young Person of the Year. And in 2018, he was awarded the Luxembourg Peace Prize as an outstanding youth peacemaker. He is currently affiliated with many outstanding youth networks and organizations, and he holds an MSc in Conflict Security and Development from the University of Birmingham. Today, he joins us as the Pan-Commonwealth Coordinator of the Commonwealth Youth Peace Ambassadors Network. So without any further ado, I would please like you to ask you to join me in welcoming Akaleki, Christian Leakey, to present to us today. Over.
Thank you very much, Julie, for this unique opportunity. I'm very honored to join this panel. And also, as a young person, I feel very elated to learn a lot from what the core group has been doing and, you know, bringing people together at this very critical moment. I'm also very pleased because the thoughts which I would be sharing are thoughts of what we have been able to gather from the field at this moment and even before this moment came. And of course, to hope that these will be able to inform other perspectives and also help in shaping other activities. I would start by introducing what the Commonwealth Youth Peace Ambassadors Network is all about. It's an association of a network of youth-led peace-building organizations across the Commonwealth, which started in 2016, and it has over 1,000 youth-led organizations, of which the organization that I represent in Cameroon, Local Youth Corner, is a member of, and I'm the chair of this network. And the organization which I lead in Cameroon is called Local Youth Corner, with whom I started as a volunteer and later became the national coordinator, which I am to date. And I would like to share with you our contribution as young people in this pandemic. But before I go, maybe we'll go to the next slide so that I give you an idea of the conflict situation that we have in Cameroon. So in Cameroon, this is from our recent publications. In Cameroon, we have violent conflict in 3 regions. In the far north region of the country, where we have the Boko Haram insurgency, which is right up north towards Nigeria. The northwest and the southwest regions of the country, which is called the Anglophone regions, which we are currently having militia armed groups and separatist fighters also fighting with military. And the amount of casualty is enormous within this period. Also, down towards the east, we have encroach of refugees from Central African Republic, which is a structural kind of conflict which we have there. But generally, the country is in a very difficult state, especially at this moment of COVID, where we are facing. Next slide, please. So this is just an idea of the casualties we have so far, the challenges which we've had based on the violent conflict situation in the far north and the northwest and the southwest regions of the country. And very, very important thing is the fact that the Anglophone crisis, which has lasted only for 3 years, has been able to cause more disaster or more harm than the Boko Haram insurgency, which we have in the far north of the country. And these are very complex conflicts, which we have been working on. And I would like to highlight that one of the key initiatives that we have been able to do on these was setting up of the first youth mediators network of insider mediators, young people who are working on mediation and reconciliation at different levels in this conflict-affected region. And of course, our extensive work of working with former violent extremist offenders and offenders in prisons across Cameroon. Next slide. Now, on COVID in Cameroon, came in March. On March 7th, we had the first air flight which came in from Air France and brought in some persons who were infected. And by March 16th, the state called for a state of emergency, closing of borders, So far, we've had 5,356 cases, and we've had cases which have been tested positive, and we have 3,326 of these cases that have recovered so far, and we have 1,177 deaths that we've had. And from these statistics that we have, I would just like to highlight that most of those who have lost their lives in this pandemic are aging and also people with already existing conditions. And for the recoveries that we've had, the state has not been able to establish publicly what they have been using to recover persons. But we've had several rumors, which I think it's not the bone of contention for today. So I would not like to talk a lot about that. So the next slide, please. Now, with the outbreak of COVID-19, I would like to share a little story of inspiration. Before the outbreak of COVID-19, I was invited to Spain to receive the Premio Mundo Negro, the Fraternidad Award, which was an award for the contribution that my organization has been doing in Cameroon. And during this time, this was February in Spain, and the coronavirus was in China, and there wasn't a lot of panic in Spain. So I left Spain, returned back home, and I already had the notion about preventive. But I realized that back home, 15th of April, people were not talking about hand sanitizers. People thought it was something very far. Then I told my colleague in the office, I said, can you purchase some hand sanitizers for us to have and see how we could wash our hands and put other things to prevent? And it was a yes, but she was so slow in doing that. Unfortunately, the only time she was able to do that was after the declaration of the lockdown on the 16th of March. And when this lockdown was declared, we noticed some few things. The first thing is we noticed that, people were worried and scared because access to clean water was a challenge. It's a big problem in Cameroon. We noticed that there were issues of increase in the prices of preventive equipment. Hand sanitizers became very expensive. Face masks became hard to find. And also we realized that there was a high rate of misinformation and fake news regarding the pandemic, causing a lot of fear and fright. Now, as a peace-building organization, looking at these challenges from different angles, we saw a gap and we saw potential conflict if we were not able to respond to the challenges that were coming up because of the crisis. And because of this, we decided to launch a campaign called Operation One Person, One Hand Sanitizer. The campaign was aimed at mobilizing young people from biomedical fields and also young volunteers from different walks of life to see how we could produce hand sanitizer to give to communities for free. Because we know that we could not start digging boreholes to provide potable water, but sanitizer was one thing we could do. And as a peace-building organization, one of the things that we did first was collaboration, which is a very important tool in our strategy. We had to collaborate with other young people, and I was providing the leadership in this process. As a result of this, we had to set up a rapid response laboratory to produce hand sanitizer. And then we did a call for volunteers online, young people who registered online to come and support production process. And we had 7 medical practitioners who joined the campaign. 1 laboratory scientist, 2 pharmacists, 1 medical doctor, 1 wash engineer, a nurse, and a safety expert that joined this initiative, and that was our vision. But as time went on, we decided now to re-strategize our program to see how we could use our existing peace-building tools and structure to be able to respond to peace and security needs at this moment while providing, information about COVID. So our strategies included mobilizing young people, and we created a coalition. We focus on using existing peace-building strategies and structures, and by these, I mean, before the COVID crisis, we have been working on training peace ambassadors with UNESCO. We have set up the first youth mediator network in Cameroon and realized that these are all young people who have the capacity and know-how and understand the conflict situations that we are having in the country, and they can best communicate and interact with population in times like this. So we decided to work with them as frontliners in this process. Another thing which we focused on was on communication. We realized that communication was a big gap at this moment. And also, since there was misinformation about young persons amidst COVID, in the sense that within the African continent, there is a lot of misconception about, young people don't get sick, so we realized that young people were not caring much. And that's why our strategy of mobilizing them was very important, because while mobilizing them on the online platform, they take courses on COVID to give them knowledge on how they would not just stand aside to watch the older suffer, but serve as an accompaniment to support them in this process. And that's why we're mobilizing young people. And our sensitization campaign focused on online and offline. Online, firstly, because there were some young people who are not willing to go out of their home because they are scared. But we thought it wise that while sitting in their confinements, in their homes, they could still engage in communication, ensuring that they give right messages and communicate effectively, while we had another group of young people who were willing to go to the field to do sensitization in the field. And this was the face-to-face sensitization. Another thing was the production of the PPEs. So we set up the laboratory. And another thing which we realized, and building on an existing project which we had, was how do we support prisons in times like this? Now, we had previously worked in prison, and we have a current project where we call prisonpreneurship, where we train inmates on entrepreneurship and vocational skills. We had set up entrepreneurs sports within prison. So we decided that prisons are going to produce their own PPEs for their own consumption, not only expecting for people to bring to them for donation. And also, we work with disadvantaged groups like internally displaced persons and prisoners who have left prisons and have set up their own enterprises out of prisons, like tailoring workshop and others, to produce PPEs like masks for the distribution. So this was the strategy that we used, using existing structures that we have created for peace to be able to ensure that it is used effectively. Another key thing that we are focusing on is collection of data on community perception. This is very important because we have high rate of misinformation, where religious leaders are calling COVID to be maybe a 5G issue. Religious leaders, there are a lot of conspiracy theories and many things happening. People are not sure, people are not certain. So we decided to collect data on people's perceptions regarding the conflict, regarding the crisis in these communities using the Kobo Collect app. It's an application where we had a survey. Working with our WASH engineer, we were able to set up these questions. And among these questions, we had key issues around peace and security situations in these regions. Then we focus on counter-narrative, countering misinformation, fake news, and hate speech amidst the pandemic. There is a lot of trauma, especially persons who have been tested positive. There is a lot of fear because people are uncertain of what to happen. So within our operations, we set up a call center where we receive calls, we counsel people. We have 2 counselors who do this process of speaking to people. We focus on sending bulk text messages, and we focus on producing stickers and other communication materials which carries messages of peace, but at the same time it's talking about COVID. Now, with this explained, in the next slide, I will show you how each of these things we've been able to do with some pictures as evidence of the work that we've been able to do. Next slide. Now, for the production of homemade hand sanitizers, we had to set up a rapid response lab. It was really crazy that, a peace building organization, now it's a laboratory. It was a crazy idea, but to us, it was the ability of young people to demonstrate leadership in times when even state institutions are confused of what to do, to start up and to demonstrate the ability of working together towards fighting a common enemy, especially in a country where we have socio-political problems which are in line with, regions and people's identity. So we had to set up this laboratory, and so far the good news about our work is we've been able to produce 20,000 bottles of hand sanitizer so far, which have been distributed across the country, especially in these conflict-affected regions. Because in these regions, hospitals, health centers have been the target of the fighters. And in most cases, they don't have hospitals, they don't have access to potable water, and many other challenges which are existing. Next slide. Now, another thing which we did as young people was not just to produce these hand sanitizers, but was also to ensure that we follow due process and we respect state institutions and the rule of law. And because of that, we presented our concept to the Minister of Youth Affairs and Civic Education and the Ministry of Public Health. The state was very impressed, and the state had to host a national press conference where the Minister of Youth Affairs, in collaboration with the Ministry of Public Health, presented the hand sanitizers to the public to confirm them for public use and to confirm the quality of the product. The pictures shows, these instances. The key things are important in our work. We have so far had 2 validations from the Ministry of Public Health and from the United Nations Clinic in Cameroon. And so far, over 50,000 people in 80 communities are using our hand sanitizers because we have some which are bigger, slightly bigger, which is used for family, and we have some which we produce, which is 100 ml for personal use. Next slide. Now, face-to-face sensitization process and online has been very important to us. One of the things that we added in this process was firstly working with elected officials within these regions in our process of sensitization. The photo speaks for itself, how we get into these communities. We ensure that rural communities in these conflict-affected regions, we try to communicate with to them, especially in the places that we could have access to. In one of these instances, we actually got to the field with a military Humvee with security forces protecting us because we got into the heart of these zones. But one thing we learned, the fact that we were not attacked taught us one lesson. And we realized from our collection of data from the community that the armed groups were more subtle and did not attack because we were coming to solve a problem which they themselves were afraid of. Now, this was very important because it showed us the possibility of this pandemic to be an opportunity for people to lay down arms, for people to work together to solve a common problem. This was one lesson that we learned in this process. It was very, very important throughout this moment. And the fact that young people were on the field to get this done. Next slide. Next slide, please. Julie? Now, this second picture shows our use of, can you go back, please? Back. Okay, once more back. Okay, so then this photo, actually, this is in the final region of the country where we have the Boko Haram insurgency, and seem to realize that there are some communities where we could not penetrate because of the risk. We use megaphones and loudspeakers. So this is a project which is being run by our colleagues in the final region. We are working with UNICEF on this project where we get loud speakers and we put the sensitization message in French, English, and the different vernaculars based on the different places that we are going to. We did this because we realized that there are some persons who cannot understand English nor French, which are the main official languages. So to contextualize the sensitization process, we had to translate these messages into local languages, and using motorcycles and using Bluetooth speakers, we go within the communities and displays morning, afternoon, evening to sensitize people about the virus and how to prevent. Next slide. Now, another key thing in our communication strategy is the use of door stickers. Now, we realize that amidst COVID, a lot of people sit in their homes. So then it was good for us to get to them to their homes by giving them a clue of the preventive measures And in the conflict-affected regions, we invite messages of peace on these stickers, where we stick on doors, on public places, to sensitize people and also speak to them about peace in a very subtle way, because it's a very sensitive environment. So sometimes there are misconceptions of, you know, who comes to say what. Either you are from government and you are called a government operative or something of that sort. So we are very strategic in communication and working with our peers on the ground who are already activists and peace ambassadors on the ground. We are able to effectively communicate using the stickers. Next slide. Now, I mentioned about collection of data, and we use the Kobo Collect app, which is an app from Play Store, which we download, and we train the volunteers online on how to use the application. And this survey to us is very important, because at the end of this process, we would want to, provide well-informed publications and policy recommendations reflecting on people's perceptions. And so far, we've been able to collect 1,000 respondents so far. And we are effectively using these in the conflict-affected regions of the country. And it is really helping, for example, about people's perception on the use of a vaccine, if there is one. I would like to let you know that about 80% of persons said no. And the reason was they don't trust, the quality of the vaccine. And these are all because of conspiracy theories that exist on the internet, and of course, misinformation and many other that is existing. And that's why on the field, we try to communicate as well effectively on these issues. Next slide. So with this, I would like to close my presentation looking at the key challenges so far. I think that the COVID-19 has come to change a lot about our habits, and this is affecting a lot of persons. In Cameroon and in other countries across the Commonwealth where our peers are currently carrying out activities, we realize that communities are in more fear and in panic, because the pandemic is changing the way of living, which was lifestyle, especially in our context where there was a lot of communal life in many activities. These are things which are being stopped, which are key and to people's life and the way people do things. I mean, this is one of the things which our survey also captured effectively. Also, we realized that COVID-19 is making way for the drivers of conflict to be more existent. For example, many people are losing their job at this moment. There's high rate of poverty. People are not able to go to school. And of course, terrorist groups at this moment, for example, Boko Haram, in their messaging, are using this as an opportunity to radicalize further, to demonstrate gaps in healthcare system of country, and to use an opportunity to hate and also to communicate on their favor. So this is another challenge that we saw. A lot of people are worried about post-COVID. What is going to happen with their jobs? What is going to happen with the resources they have? In the US, for example, remunerations were given by the states. In our context, there's nothing of that sort. So poverty is increasing, fear is increasing, panic is increasing, making it very challenging for us who are working on the conversation of peace to be able to respond effectively. Now, looking at, for the opportunity, just to round up.
Okay, perfect.
Yeah, just to round up. And I think that from the experience we've had on the field, in the conflict hotspots, I think that there's a great opportunity that this pandemic could support social cohesion, because people are looking at a common enemy. Speaking to some families, they're thinking that this is the time to forget about what divides people and unite to fight the common enemy. I mean, this is something which is very key. And of course, our findings and on the surveys that we've collected clearly demonstrate this. So, in grosso modo, this is what we have been doing, working on innovation, working on existing peace building structures to strengthen and to ensure that we are able to respond to peace and security challenges, as well as the COVID-19 pandemic in our country. Thank you very much.
Oh, thank you so much. Thank you so much for a wonderful presentation. And what I really appreciated was how you were able to, all of the innovation and using groups to address some of the largest challenges. I just want to take a little pause here before we start the discussion. And now that we have some context, I'm going to ask David to put up another poll for us just for a moment. We've had 12 webinars now, and I'd like your feedback in terms of what you believe was the greatest need expressed by participants in past webinars. And I think that many of these things were discussed by Akaleki. So if you could just take a moment to make your choice, and David will tell me when he's ready to show the results. That's what I love about these polls. Okay. And David, whenever you're ready, you can just pop up the results of anyone that we have. And while we're going to the polls, before we go into discussion, Akaleki, I actually have a question for you. And that is, in your introduction, I noted that you had inspired thousands of young people throughout Africa and around the world. Before we get into the specific question from participants and a discussion about what you're doing, I would like to ask you, what inspires you?
Well, I think the first thing which inspires me is my past and where I grew up from, and inspiring me in the sense that it gives me a reason to want to solve these problems. Because sometimes people might talk about conflict or violence without knowing what it looks like, and people don't know what it means for someone to be burnt alive, or for someone to be stabbed, or for someone to be killed. I mean, people that you know. So all of these happenings, which I grew up seeing, really, really inspires me to do different. But also because of the fact that growing up, when I started, I saw people who were there to mentor and who were there to shine the light. And then reading amazing people, from Mandela to Martin Luther King to amazing people. And this was how the inspiration kept growing. And the inspiration never stops, because when I see the works of people like Saji Prelis, Victor Ochen, and many other young people in the continent and in other parts of the world, the inspiration keeps building. And most especially people that we've worked with who have had an alternative, like the story of Michael, an inmate whom after 16 years in prison, we worked with him for 3 years. And when he left prison, today he started up his own enterprise, and he currently has 3 people he's employing. I mean, stories and transformations like this, preventing people from going back to violence, using my story is what is keeping us strong. And of course, the amazing team that I've been working with in Cameroon and within the Commonwealth and other parts across the world. That has been actually the inspiration.
Well, thank you so much for that. I'm wondering if we could unmute Giorgio Trombatori if he wanted to make any comments before we move on to the next panel of the panelists. Giorgio, I just wanted to ask you, being in Syria, and I know you've worked all over the world and working, looking at what Akaleki has shared with us, is there anything that you want to draw out before we move on to the next set of panelists? Over.
Hi, Julie. Hi, everyone. Not really. I just want to actually give my congratulations to Akaleki, because from the voice and it feels like he's very young, but very much motivated, and thanks a lot for the presentation. And I'm a bit wary all the time. I know we have, my 2 colleagues have prepared some very good insight about Syria. You mentioned it very, very right there. Syria, as you know, we are facing a lot of We have a lot of problems related to access, specifically for the Northwest, but as well situation regarding the Northeast are also very concerning. I just saw also this survey that you shared, and we're going to talk about these elements, about also specifically about the PPA and all that is within that. So thank you very much, Julie, and again thanks for the presentation for Akaleke.
Yeah, I'm just really pleased that, thanks for those comments, Giorgio. So we're going to move into the next set of panelists now, and I'd like to ask Judy to, we'll move to the next slide, David, so that Judy can start her presentation. Thank you, Judy. Please, the floor is yours.
Okay. Good evening from Mombasa. It's evening here. Good morning over there. Good afternoon. Judy here, Search for Common Ground. I want to start by introducing the organization. Search for Common Ground was founded in 1982 and makes the largest conflict transformation organization that we have. We are currently operating in over 35 countries across Africa, the Middle East, and Asia. And we are focusing on conflict geographies. And that's why I wanted to introduce us, so that when you see the presentation as we go on, you'll notice I'll be talking about a conflict geography. So our focus on conflict transformation is looking at conflict dynamics that spill over beyond country borders. So we over time have learned that conflict is not confined to country geographic borders, but it spills over. And as a result, we've mapped out 10 conflict geographies globally that have affected millions of lives. And the Horn of Africa, where I sit today, is one of the conflict dynamics or the conflict systems that we are working to transform. And our work is to address the way people deal with conflict, providing opportunities for collaboration, understanding the differences, and moving people away from spaces where confrontation and violence occurs. So diving into the presentation, next slide, please. I will be focusing on gender and the Swahili Coast, and looking at some of the things that we have realized and noticed. And the recommendations that will be coming at the end form part of a policy paper that we developed and shared, which we shall also share as part of the resources that come out of this meeting. So I'll be speaking about the Horn of Africa conflict geography. And as I said, we define our interventions based on the boundaries of the conflict system. And in the Horn of Africa, we include Somalia, both South and Central Somalia, Puntland, Somalia. We include Kenya, Tanzania, and northern part of Mozambique, because we have noticed there is a connection that brings all those countries under the same conflict geography. And depending on the dynamics, we will also probably work in Ethiopia, largely in the Ogaden region, and most likely have work done in Addis Ababa, which is the seat of the Africa Union. David? Okay, so I will be looking at the issues that have been part of the Swahili Coast dynamics that we've been addressing, and looking at the new overlap, the new overlay of COVID-19. What does that now mean to some of the issues that we've been addressing in the past? So we have worked in a space where there has been a sense of disenfranchisement and political exclusion in the Swahili Coast over a long time. We noticed that there was deep marginalization, deep stigmatization of communities living along the Swahili coast, being labeled as sympathizers of the violent extremist networks, including Al-Shabaab. And COVID now comes into the same space, and we realize that over and above the political exclusion, that COVID relief and COVID responses are beginning to take partisan lines and partisan interests. We also are addressing economic marginalizations and threatened livelihoods along the Swahili coast. And what COVID is doing is that it has created an economic meltdown, which would also be known as a downturn, that has completely wiped off most of the small-scale businesses, has seen a loss of jobs, has seen many low-skilled workers lose their livelihoods. For example, those ones in the hotel industries, those ones in the small businesses, when the lockdowns and the partial movements and curfews have happened, many have gone under. We have also we've also been noticing lack of development and support. Oops, sorry, my charge is going down. Hold on a second. Sorry for that. Hold on. Okay, that's better. So we notice a lack of development and provision of support services in some of these very vulnerable regions, especially along the coasts and areas that border Somalia all the way right into northern Mozambique. And what COVID is going to do, or what COVID has begun to do, is that the COVID response is withdrawing personnel and resources from key priority areas. So you realize that the attention of the security actors is now on enforcing COVID. You realize the health sector, the health practitioners all turned to address the COVID threat, and therefore key services, including responding to gender-based violence, is very thin. The support that communities require in these other sectors has tended to be very thin. Over and above, in Kenya, we are facing floods in the same communities where we are having the issues around violent extremism. We have floods, we have locusts that have swarmed in from India and the Arab Emirates and the countries over there come through Ethiopia, and we have swarms that are wreaking havoc in the country. And because of flooding and because of historical marginalization, we've got very broken infrastructure, including communication infrastructure. What else are we realizing? There has been eroded trust between citizens and security actors. First, because the response by the state to address violent extremism was hard response. So they landed heavily on those communities, and the communities began to become afraid and wary of the security actors. What is COVID response like? The security actors again have come with hard force to enforce the COVID measurements. In fact, in the first 6 days, in the first 10 days of the enforcement, we had lost six lives, more lives than even COVID itself had led to. So the heavy-handed approaches begin even to be more heightened than the COVID pandemic itself. We also have societal expectations around jobs, marriage, religion, that youth have difficulties meeting. Youth in this region would want to marry, they would want to have good jobs, they want to actively engage in religion, which sometimes faces the wrath of security actors. But now COVID has come in and curtailed the sense of community. Recreational activities have been cut down. Economic activities are becoming quite a challenge for young people to find meaningful ways of putting food on their table, including women. One of the women recently was boiling stones for dinner so that her children could wait for the stones to boil. And the mother did that so that they think it is food. And they slept through the boiling of the stones. We also have cultural activities that have been curtailed as a result of the COVID response measures that we have in place. We have terror groups exploiting community grievances to gain support. The closure of places of worship. We just came through the season of Ramadan, the cessation of movements, the killings resulting from brutal police force have seen increased support of the narratives that are coming from VE networks. And this is something that is important to focus on, because if the response by the state is playing into the hands of the violent extremist networks, that means that there's an issue that needs to be addressed at that point. But also that the fact that citizens and the clergy may not understand why COVID measures are important. And therefore they take it as an attack on their religion, an attack being looked at as a Western way again of bringing down certain religions. There's political partisanship and ethnic nepotism. And COVID response is beginning to also ride on strong political wings globally. And here in the Swahili Coast, you'd know that one of our countries, Tanzania, has a strong position on COVID management. And part of the reason I was not able to give the figures is because one of our countries of action do not have any updates of what's happening in terms of COVID spread or COVID management or who is recovering. The other threat that has been there that is being aggravated by COVID is the rise of juvenile gangs and other criminal threats. So we have reported break-ins, we have reported gangs trying to manage communities, and they're using force to put in COVID measures. So if they find you at night, they flog, they beat, and things like that. We also have Al-Shabaab along the Kenya border in a place called Huluga are breaking into shops at night and stealing the supplies. We also noticed that there's been struggling parental support systems and struggling families, especially those who have, especially those families that have women who lost relatives and they're breadwinners. And COVID aggravates this because one, the personnel to do this has been reduced. Two, the resources have not targeted this particular kind of need. And again, the COVID measures included social distancing. So one thing that happened is that the one-on-one support that was needed has become even more limited.
Judy, we're at about 10 minutes now, and yes, we have 2 more presentations. Could you do one more slide, and then we'll bring the recommendations into discussion? Over. Okay, very well. So quickly, what are we noticing in terms of gender prevention and protection? Most of the people who are left out of public information campaigns are women. We also notice that women reject the protection and prevention measures because of mistrust and fatalism. And sometimes they just have to make a choice. Is it food or is it a mask? Oh. I did it quick, Julie. Oh, you're so good. You're so wonderful. Yeah, thank you so much, Judy. And then we will, we have some recommendations and we will pull those up a little bit later, okay? Yes. Yes. And then I have some good questions for you as well. So thank you, Judy, for framing those issues, especially as it relates to women. I'm going to ask Dr. Kassam if you could please move into the overarching issues.
Yes, thank you. Thanks for the opportunity. This is Dr. Qasim Balut. I am Whole Syria Health Specialist. It's my pleasure to be in this panel. Thank you. I will brief you about what RI is doing in terms of COVID response in conflict affected areas. I will focus more on Syria as a sample of fragile setting and one of the areas affected by the conflict. As you all know, RI mainly focusing on 4 key sectors: health, nutrition, education, economic opportunity, and wash, sanitation, and hygiene. in fragile settings, and sadly saying that Syria is one of the maybe example of being fragile. Or in these fragile settings, Syrian crisis started 2011, and due to the instability, civil war there, it led to collapse of the many sectors, health, economic, education. According to HNO 2020, about 11 million people in need in Syria, more than 6 million IDPs, internally displaced, more than 6 million refugees outside Syria. In this context situation, or in this situation with severely limited access to the essentials, non-functioning of the local markets, poor private or weak private sector to cover the essentials, in addition to instability and civil war in Syria. This led to collapse of the, as I mentioned, essential sectors. What ARA is doing there, ARA is focusing on health sector, nutrition as well, and integrate WASH activities in the support health facilities. ARA is supporting more than 30 health facilities in all over Syria. ARA has more than 1,500 direct and incentivized staff working inside. ARA health facility is providing more than 65,000 consultations on monthly basis. In general, ARA is focusing on primary health care, maternity, child health, reproductive health, as well as mental health, in addition to prevention, detection, and control of diseases outbreaks. ARA has a network of community health workers trying to bridge community and link them to the designated health facilities there. This is a brief about what we are doing in Syria and overall the situation in Syria. Now I will move to the challenges that we have in place, that we are facing in terms of implementing these activities. Can you, David, move to the next slide, please? So since we are working in armed conflict areas, so the main concern of the NGOs or all the health partners working in Syria is continuing to be the security situation, instability, different actors, different parties to the conflict, different regions under different parties or different armed group control. So the security situation is the main concern. Attacks on the health facilities. In 2019, 85 health facilities have been attacked. Almost 50 water facilities have been attacked. In addition to that, this instability, creates an opening window to jihadist groups, to, sleep cells, if we can say, to attack maybe key actors, health partners, health facilities, governmental structures on the ground. Control shifts, it includes in the security situation, since we are working in different regions. So control shifts depends on the permission that you have to continue providing quality healthcare services on the ground. So the security situation is the main concern of all workers, all health partners on the ground. We are depending on remote management modality, which is a challenge in terms of, we are accountable to the beneficiaries, accountability to in front of the donors to ensure provision of quality healthcare services, which need to have communication channels, communication tools, follow-up, protocols, guidelines, as well as quality healthcare services on the ground. Health system capacity itself, after 10 years of the Syrian crisis, only 53 hospitals are fully functioning. Only 51 health facilities, PHCs, are functioning. The rest of the health facilities are either partially functioning or even not functioning. The human resources, availability of the human resources in terms of qualitative and quantitative. No district in northeast or northwest Syria met the emergency threshold of having 22 health workers per 10,000, which will put pressure on the existing health facilities, on the existing health workers, so they will be overwhelmed. The health system capacity will be stretched very soon, and of course this will affect their response to COVID-19. One of the points that we can add here, regular supplies of the medicines, medical consumables, or medical commodities in general. This might be affected by the security situation, by the access of the, humanitarian health partners to the health facilities. Here, because we are not talking about only COVID-19, what we only need, or what we as well need to ensure, is maintaining the regular health services that we have in our health facilities, which is something crucial to the people in need there. Here I'm talking about non-communicable diseases especially, and the surgeries. I can as well add as a challenge access to the health facilities, which might be affected by the security situation, as well as the maybe non-renewal of UN resolution. You know, in Syria we have the UN Council Resolution 2165, which authorized the UN agencies cross-border assistance to be provided to mainly local partners working in Syria. So in terms of, in last July 2020, this UN resolution was non-renewal, renewed in Northeast Syria, which affect more than 50 health facilities working there, depending on UN agencies to be, supported. Funding as well, this might affect RI and rest of the health partners working there, working in Northeast and Northwest Syria, as I mentioned, the UN funds especially. Can you, David, move to the next slide? So all these challenges will be already aggregated by COVID-19 outbreak. As I mentioned, this will stretch the health system capacity. This will be overwhelm the existing human resources. This will affect the regular supplies of the health facilities. This might affect the access to the health facilities in terms of the movement restrictions inside the country and all over the world. Maybe good point to mention here, the new regulations imposed by certain donors to procure PPE, personal preventive equipment, which caused delay in planning and implementing COVID-19 related programs. We all know that there is a shortage all over the world in PPE, but additionally, new donors started to impose as well restrictions to purchase these, to procure these PPE items. And as well, the countries around Syria start to impose restrictions, to export these items and send them to Syria, just to keep them in the countries due to the overall or the global shortages outside Syria. As well here, as I mentioned, the health system capacity in terms of COVID-19, in terms of lab testing, as well low capacity in Northeast Syria, and as well in the South Central, which is under the government of Syria control. This might, all of these challenges might affect the response to COVID-19. My colleague Alia will talk more about the mitigations that we have on ground in order to keep our prioritizations of staff saving and business continuity as usual in the supported health facilities. Next slide, please. Okay, maybe we can move them later, and since we talked about them, Julie, about the social
that would be great, because we're up about 10 minutes, and we'd like to hear from Alia.
Yes. So over to
you, Doctor.
Thank you.
Okay, thank you, team. So bear with me. I'm a true 40 years old, but have a voice of 10 years old. So I will try to raise my voice as much as I can. So as Dr. Qasim mentioned, definitely in the COVID, the shift of main objectives of our Syria response was not shifted actually. It's still focusing on delivering high quality services of healthcare plus staff and beneficiary safety. However, still facing the security challenges and might escalation be at any point, this was really challenging within this remote context that we are talking about. In addition to the different countries started to impose some laws, regulation, and impacting really the mission and how coordination level. We operate for Syria from Turkey, Jordan, Lebanon, Iraq, and Syria itself. So imagine how this is happening during all of different restrictions or curfew is happening. Definitely business continuity is also part of the plan, how we can ensure delivery of these services under the COVID. We started on 16th of January, disseminate all important information. Our ICAM was a motto, prevent, prepare, don't be scared. This is cascaded from the CEO until the field team on how to mitigate and prevent. Then we conducted a very many Skype group messages with the field team in Syria, discussing how we can prepare ourselves to this, how the scenario pays in case of the first cases identified, how we can actually prepare ourselves. And this is also took a bit of time in order to have all of this Skype group. Starting from mid-Feb, the work modality of some of the countries that we are operating has been impacted either by movement restriction imposed by local authorities or RI consideration. For example, in Turkey, we took the decision to close the office before even the government announced it in order not to expose our staff. On 22nd of February, COVID awareness sessions had started. Different countries, definitely in coordination with the health team. And this was a bit challenging because if you can move to the next slide, David, you can see that the context of Syria has too many challenges, not only remote context and the conflict itself. It is the internet, it is the infrastructure, it is the access. You have a remote within remote. I have staff in one area in Syria cannot actually access like 10 minutes area. So you need to have alternative options, how you deliver your awareness sessions, how you make sure that your staff is aware of what's happening, and it is under the duty to inform. So you can think about maybe luxury Zoom and Skype. Sometimes it's very impossible to have it. So you need to actually adapt and have your agility at highest level in how to deliver the information. Next slide. This is started the duty of care actually, and this is for Syria because all the staff under different countries, they are protected under the laws, regulation, and labor law. In Syria, you need to think that there is no labor law, there is no governmental parties. So actually RI rely on its own policies and processes. So we started to update our duty of care, and this is directly after the WHO announced COVID as a pandemic on 11th of March. And we included two parts in our duty of care, especially when we communicated the donors and they have confirmed that public health emergency can be cascaded or like categorized under force majeure. So we have extended our sick leave. We've been discussing with the health team, la samahallah, in case one of the staff has been exposed to a positive case and he need to do self-isolation or unit quarantine, that's almost 14 days. Plus, if he, la samahallah, it was sick, this is almost more than 1 month. So we asked our donors to approve duty of care of covering 2 months full salary for staff under sick leave. The second part, that in case of suspension due to movement restrictions, Dr. Qasim mentioned about community health worker and how this important role in our program actually that they are part of the awareing the communities about this disease and how to prevent, how not to not spread. So in case there is an cases in Syria, so we need this activity might be stopped. However, some types of the staff, their work cannot be considered as working from home. I cannot ask a community health worker whose her main task is household visit to do her job on WhatsApp or on Skype or on Zoom. So that means I need to notify the donor in order to stop the spreading and in order to keep my staff safe. So this activity will be stopped. So we as a donor, they have approved that 1 month will be paid until this maybe there will be a release on the restriction, or maybe we can use a paid leave, unpaid leave after this 1 month suspension. Last slide. The most important topic, which is staff well-being. I think all of us who are here now hearing this presentation, definitely we have been through some of stress or maybe burnt out. The amount of information is flowing is definitely, nobody can take it as a neutral, you know, and not be impacted or affected. Our families are scattered around the world. Each country has their different number of cases, different level of cases, death cases, so it's really impacting us. Plus, add to all of this, when you speak about Syrian context, there is the uncertainty of this business continuity. I'm still having this income or not, I'm still accessing the health facilities, the free services or not. All of this, it really can be a burden and can cause a strong emotion. So in January and February, in order to ensure staff well-being, we introduced as RI the right to withdraw. And this is a key concept actually cascaded from global support office until the field staff. That meaning if anyone feels that they would prefer to stay home working, such decision will be respected and will not impact management perception nor performance judgment, especially for cases that if they have chronic disease, if they caregivers, they have elderly at home, they have children, nurseries are closed. So all of these cases will be prioritized, and then we looked at if they need actually to ask this, they have the right. Then, you know, when we are being in the office as a supervisor, you can easily tell if your subordinate is stressed. You can see his expressions, his body language. You can even spot his face that he's stressed or not focusing. However, working in remote context completely and virtually, you are missing something. We call it in the psychology telltale. That's mean you cannot see this person if he's stressed, so you need to have alternative options. So we conducted many calls to equip supervisors of alternative screening methods, spot stress, and how to provide support. One of the screening, it can be distraction. He is not actually focusing in meetings. He is working against the working hours, like he is not responding working hours while working at night. So all of this, it can mean something, and that's the supervisor responsibility to spot and lead him to what options we have, what is support I can do. We also did like a third-party contract with a psychologist who provided psychoeducational session to all staff. And this is for sure, it's not mandatory, but it's optional. And we can always speak to staff, use these services, it is good. And we can share with them the benefits of having these individual sessions. Then for sure, we are providing stress management training, self-care messages on weekly basis, all of this in order to reduce the stress on our staff and helps them actually to adapt and still having the right level of agility, that this is one of our I values. Thank you.
Thank you so much, Alia. We really appreciate that. I put a couple of questions in the chat box. There's one specially for Judy Kimano, and there's one for Dr. Kassem. I will also be putting a question in for Alia M. Now I'm going to ask Michael Bryan if he'll come on for a few minutes to kind of wrap and contextualize what's been talked. I think he's got some nice overview slides that also have specific examples of DRC and Yemen. Mike, welcome back to the call. You're on.
Okay, thanks a lot, Julie, and great to hear Eli and Dr. Kassem as well. And I promise I haven't copied their presentation. It just happened to be thinking very similar. Yes, I'm Mike O'Brien. I'm the health advisor for the crisis response team for FHI 360. Yeah, go ahead and go to the next slide, please. Yeah, great. So this is kind of what we're worried about, FHI 360. Yes, we're worried about COVID and staff and our communities that we serve becoming infected. But really, what we don't want to see is we don't want to see the collapse of the essential services they're really necessary and are really saving so many lives. So this is a study from Dr. Robertson that's published in the Lancet, where he and his team looked at the Lives Saved tool, did some calculations and some different estimates, and you can go there. I recommend looking at this article. And yeah, just what could be the impact if the demand side or the supply side of essential services really collapses. And then the second one is just an article that was published in Al Jazeera that was picked up, I think, from Reuters. It's a little bit of an exaggeration, but it just talks about Yemen's health system has collapsed. Like I said, a little bit of an exaggeration, but not something that we really want to see. We don't want to see the collapse of services, and we don't want to see the disruption of essential health services. So we know from the Ebola outbreak in West Africa that there were about 11,000 deaths from Ebola, but probably a projected 10,600 or so maternal and child deaths just from disrupted health services. So almost equal to the amount of deaths from Ebola. And that's really what we're risking here. Next. Thanks. So just kind of what we're seeing in Yemen, and we're seeing it similar in DRC as well, but priority is staff welfare. And as Aaliyah talked about, the priority is our own staff welfare, of course, but we're also seeing governments and, other agencies and organizations that their staff welfare is priority as well. And that's also a little bit disruptive for humanitarian operations. For my next point, delayed clearances of imported goods, not necessarily that we're seeing we're not seeing intentional delays in clearances. It's just that when we're trying to get our pharmaceuticals into country, we're seeing that the government officials that need to sign, for the forms and things, they're just not available. They're at home, they're being protected from COVID-19. So it's really having some disruption into our in our operations there. Delayed visas, very similar. We just can't track down some of the officials that we need to be able to get the visas to be able to come in and support. The same thing with, just movement within the country. There are some restrictions in movements that are official. There are some humanitarian exceptions, but those aren't evenly applied throughout the different countries. And they're not applied evenly from different officials from one day to the next day. So we're seeing a lot of confusion from our government partners on where we're allowed to go, what we're allowed to do. We're having staff that are getting stuck in different locations and having difficulties getting back to their offices, or we're having, just odd difficulties getting out to our communities. And we're seeing the same thing with some of our community-based activities as well. And we're also seeing adaptive ways of working. So this is a little bit of a silver lining. So for instance, the Yemen Health Cluster has conducted a couple of, Zoom coordination meetings and things like that. And we're seeing some of our own adaptive ways of working, different ways of providing that supervision in the field, looking at expanding how we do our community health work to really empowering the families as opposed to putting the sort of the frontline workers kind of there when we're able to kind of task shift. So we're working around those different things as well. All right, next slide. Yeah, so what we're doing, yeah. So our biggest thing is to maintain our essential health services. So the things that are saving lives on a daily basis, and as you know, in Yemen and DRC, conflict zones, prone to outbreaks, we're still not out of the woods yet with Ebola in DRC. Yemen, the worst cholera outbreak in the world a few years back. So maintaining those essential services, maternal child health services as well, are very important to us. And we're scaling up surveillance, not just COVID-19. That is, of course, on the list for our disease surveillance and response mechanisms, but also we're scaling up nutrition surveillance. We don't want to miss any malnutrition cases, severe malnutrition cases, simply because we've got our eyes focused on COVID-19. We're expanding our community event-based surveillance in the DRC because we want to make sure that we're vigilant there as well. And we're reassuring our healthcare staff, because if healthcare staff don't feel that they're supported, they don't feel like they're safe to come to work, then they might not come to work, whether they're sick or not. And just as we've seen, we really need those essential services to stay open. So maintaining that, giving them the tools they need, giving them the supportive supervision they need. But as Dr. Kasim mentioned, some of that personal protective equipment and those things are going to be a little bit more difficult to come by. So we're having to really think around those as well. All right, next, thank you. Yep, and then just the last thing, I know I talk fast, Julie. Kind of what we're watching, and this really I think plays into what Search for Common Ground was talking about as well. you know, we're watching for increased hostilities. Yes, the COVID-19 outbreak is an opportunity for communities to come together and for social cohesion to kind of fight a common enemy, but it's also an opportunity for you know, people to take take the opportunity to sort of you know, use the disruption to get what they need. Violent extremism, armed gangs, as Search for Common Ground mentioned. So we're kind of on the watch for that. Decreased supervision of ministry officials, you know, it could lead to some difficulties down the road. We're also watching for increased inequalities. We recognize that there's some inequalities already, and some of the way that we kind of look for our participants for our programs. You know, it's really hard to reach the most needy. It's going to be even more so with COVID-19, especially as our community engagement, you know, as Aliyah mentioned, you know, it's hard to tell a community health worker to do her job from her desk, you know, so as some of those suffer, how we really reach those people, we're going to have to be creative in how we do that. And we're worried about distrust in the government. As the first presenter mentioned, you know, would people take a vaccine if it was available? A lot of people said no, because they don't necessarily trust the government to provide them with vaccines. So part of our job is to build the legitimacy of the state to do their job and provide health services. So we're on the lookout for that and trying not to undermine the government and really to make sure that, you know, our success is their success, so that we don't have to come back and try to rebuild all that legitimacy all over again. Yeah, and that's it, Julie.
Oh, thank you so much. And so there's a couple of things that are happening right now that build on and support what you've just said. Can we just stay on this slide for a minute? I want to alert the attention that Dr. Kassem has answered a question in the chat box. I have a question for Judy and Akaleki and Aliyah, and I hope to get one for Michael Stripler, and if not, I'll put it in the chat box. But what I'd like to do is I'd like to first of all, thank all the presenters. And it is really interesting, the themes that are coming out. And Judy, if you're available and you can come back on, please be on deck. I have a question for you, but first I'd like to ask Aliyah M. One question. Your organization has a strong emphasis on duty of care and staff well-being. And so many of us work with community health workers, and we know that staff care is of the utmost right now. But can you talk a little bit about to what extent Relief International is reaching out to community partners to share in these important approaches? Over.
So, Julie, what we actually use the channels of like a working group, human resources working group, or the health clusters, or any kind of coordination meetings happening, whether it is on hub level or whether it's on whole of Syria, to share what is actually we are doing. For consortiums that we are participating, we also share the information that we are thinking of, like this updating duty of care. It has been discussed on the hub level, then it is reached whole of Syria level, then regional, then we shared with the consortium. So the partners that they are with us, they can also take an idea of what we are thinking. And I'm happy that I say that for the two parts that we are working in two hubs, we were the first one to update the duty of care and have the notification from the donors that they have read and accepted this.
Oh, thank you. Thank you. Thank you for that. I think that's one of our biggest challenges, because so many of us around the world are working from home, and the needs are growing in the communities where we work. The second question I have, Judy, if you're prepared, is the communities where we work are the most, the communities where Search for Common Ground is working, you noted, are the most affected by Al-Shabaab and their perpetrating terrorist attacks. In your work, you regularly lead delicate negotiations between Kenyan security forces and local communities to strengthen security while protecting citizens' rights. Can you talk about the power of dialogue and some of the tools that you use at the community level to promote productive discussions? Over.
Okay, so we have worked with sensitive conflict issues that have pitted the state against the citizens and the citizens against the state. And one is in a place where we had a military operation that had introduced various restrictions on movement, on association, and even schools were closed and hospitals were not accessible for communities. And people had been actually asked to vacate that particular ecosystem so that the military can engage. However, we were able to find opportunities for working on dialogue spaces with the state security actors in their own space and to see how we could identify common interests, why it was important for the state to work on that security matter, and why the state, it was important for the state to see the conflict from the eyes of the citizens. Then we also had the same kind of conversations with the citizens, with the religious leaders, with the fishermen, with the men, with the women. And over time, we were able to build places where trust and ability to engage had developed, and we brought the two groups together over time. It doesn't take a day or 2 meetings or 3. It is very resource intensive in terms of time. We had in our projects we had planned for 3-4 meetings, but we ended up seeing that it was taking us further and further. And what we did is that we opened up the work and brought in more actors. We brought in more CSOs that were working on education, working, for example, Red Cross was working on health and relief services. We brought in many other actors that were working on cross-border. And we then had a pool of funds within the CSO that enabled us deepen the engagements that we needed within the community. And over a series of several engagements, we were able to identify low-hanging fruits that were of interest both to the community and the government. And we then put work in place, a way to have the groups sit together over time and deliberate on what works best. And we finally saw a ban, a fisherman, night fishing ban that was in place for over 5 years, lifted by the government together with the security actors and the communities. And the communities are now central to the management of the night fishing work. And this now plays back to the COVID, where we have seen state actors coming very strongly to manage COVID measures alongside health workers. It's an opportunity for us to look at the responses and see how can we better engage, make it wider, make it multi-sectoral, make it gender sensitive, make it more inclusive, so that the messaging is done together and the solutions are found together.
Oh, thank you. That is so great, and we appreciate that so much. Thanks for those insights and the realities there. The last question, we have 1 more minute, and the last question I have for Akaleki, if you can unmute your mic. Earlier, one of the participants said that they believe that the communities are missing regular services, ANC, immunization, contraceptives, etc. And he or she was wondering, is there anything you are also doing with the service providers and communities to solve these problems? And I think this question kind of ties into the link that we have on the needs list, the core group needs list powered marketplace. So Akaleki, can you talk about if you're working with any local suppliers? Over. Let's see if you're muted. I think you're still on there, but if we're...
Hello, Julie.
Oh, wonderful. So I would like you to have the last question. If did you need me to repeat it, or did you hear me okay?
Please, can you repeat it, please?
Yes, we were talking about the availability of to access of regular services, and one of the questions was, is there anything that your consortium or your network is doing with service providers and communities to solve the problem of access to services? Over.
Well, so far we have no intervention around that, but one of the things that we are focused on doing is a lot of more around advocacy and trying to bring young people's voices out, and that's why the coalition which we have is with the National Youth Council. The National Youth Council, which is the recognized association of young youth-led organizations. So we are working with them, through the Ministry of Youth to bring young people's voices to the needs. And issues of service delivery has always been a great challenge in a context like ours. But but we keep pushing and putting our voice into the conversation. But one of the things that we try to do is to lead by example. And that's why the fact that we started providing hand sanitizers for free has influenced a lot of pharmaceutical firms, has influenced a lot of institutions to start thinking differently, because we showed them by example that in times of crisis, it's not a time for you to make money, but for you to sacrifice. And when they see a youth-led organization that has not received any funding, be it from government or from any private donor, but has been able to mobilize people locally, fundings to produce these things, it meant a lot to them, and it's really changing perspectives. And today we see different a service provider in communications and others, they want to provide PPEs for people now for free. And it is really trying to help on people who want to make money. I take, for example, a bottle of hand sanitizer of 100 ml, which used to be sold at $2, price had to increase to $5. Just imagine our level of poverty and availability of this. So our action has been able to change a lot when it comes to service providers as well.
Thank you so much for that. I just, before we officially close the call, I first want to ask David if he wants to make a comment about the C19 virtual marketplace that Core Group is launching this week. David?
Yeah, thank you so much, Julie. I already shared on the chat the link, but I will also be sharing right now the official video. If you have time, it's just a very short video. And what's the COVID-19, the Core Group COVID-19 virtual marketplace is a place to connect online suppliers and requesters for commodities for COVID-19, for example, PPE, as well as training and information. So I'm going to share with you the...
Before you start the video, David, because I would like you to show the video, but I would just like to, for people that might be leaving the call, I just want to make sure that I thank Akaleke and Judy Kiyamono, Dr. Kasem, Alia, and Mike O'Brien, Giorgio and Michael Shipler. Thank you so much for your support. This call will be recorded and it will be up on our website. We're going to show you now a very short video of this very exciting initiative, and it's just a few minutes, but I just wanted to make sure that I got my warm gratitude out into the ethers for this wonderful panel before we go. Okay, David, it's over to you, and then after the video, we will officially shut the call. David?
As you can see on our homepage, Needs List has 4 main features. You can browse through a gallery of current issues. You can create your own needs list.
I don't know if anyone can hear me, but I guess we're buffering from the olden days. The video may come back on. So if so, the video is also available at the link.
Julie, there are some tech issues to do that, but I have shared on the chat the link, so I welcome everyone to see it.
Yeah, it's a great video, and it's really useful platform, and many of the issues about accessibility of supplies can be disrupted and addressed at the local level and the regional level, including training and knowledge management. So we invite all our members and our global partners to look at it and to become members on the platform. The results of the polls are in, and what's interesting, I have it, the procurement of health commodities is the greatest need. So this kind of ties in with the initiatives that we're doing at Core Group. We're 6 minutes over. I think all of you, over half of the group has stayed with us. I thank you all for being with us today. We will have a follow-up call co-hosted with Search for Common Ground at the end of the summer, July or August, to look at the humanitarian to development aspects of this. We thank our presenters from the field. We thank your flexibility and patience as we try to get everyone's voice heard. And thank you for participating in the chat box. The call is now officially closed, and I wish you and your families and your communities a wonderful day. Thank you.
Thank you very much, Julie.
Thank you so much. It was wonderful to have you. I'll follow